I'm going to start. Right, left, right, right, left, left. That's lovely. Thank you very much, Chrissa.
Okay, with your eyes closed. Okay, so hand up. All right. D. O. G. S. Okay, other hand. H. G. M. E. Okay, thank you.
And the reason I'm moving to your left side is I just want to feel what the muscles feel like on the side that the stroke hasn't affected. Right. So I'm just thinking about the amount of tension in these muscles. I'm just feeling how much tone is in them, if you like. Right. And I can establish that by giving them a squeeze, so I can feel these muscles have got some activity there, but not excessive. It's quite soft, and I can move the leg at the hip. Okay, I can lift the leg up. I can feel you following me when I move this leg. In fact, you've got good control of that leg, and you can move it in space. Now that tells me that on this left side in the leg, you can both feel where I'm putting it, but you can also adjust the amount of activity in your muscles as I move it. Okay. All right. And if I come up to your left hand here, again, it feels like a very light arm. You're able to move it yourself. And I can put it in anywhere in space, and you've got control of it. That means that you're adjusting the amount of tension in your muscles according to the position it's in space, against the force of gravity. So gravity is trying to drop this arm, drop this leg through the bed. Your muscles are able to counteract that and allow this to move in space nice and smoothly and freely. So that's good. It's also telling me that in this position, you're quite relaxed. Very carefully so we don't cause any pain. And again, this one doesn't quite follow in the same way. And it's tending to be, could feel quite heavy to move. And tell me if there's any discomfort associated with this. Oh. Okay, so that's good range of movement at the shoulder here. Okay, now, are you able to lift this arm in the air? Okay, that's excellent. So what we're seeing here is having to generate a lot of activity on the left side in order to activate the right. And we can see that we're getting quite a bit of extensor activity in the right leg as well. And excellent. How about we rest? So in this position, the arm is tending to come into abduction and medial rotation as it flexes. So the elbow tends to come away from the side as opposed to up in this position. Before I take the shoulder beyond 90 degrees, I just want to check that we've got a bit of mobility at the scapula here. So if you just relax for me a wee minute, just let everything go. Let me just feel what the shoulder's like here. That feel okay? Yeah. And when I'm moving the shoulder here, I'm thinking of keeping the shoulder blade or the scapula and the humerus well aligned, so we're not causing any potential trauma to the glenohumeral joint. That's the shoulder joint. That feel okay? Yeah. Okay. And then as we come up into flexion, I just want to make sure that the scapula is following here. So I'm just feeling the spine of the scapula here, down to the, that's perfect, thank you, down to the inferior angle, and just make sure the scapula comes up as well. Any pushed into this sort of position. Again, we can feel that there's a little bit of a tension to extending the fingers, but again, in relation to the surgery, I'm not going to push this too far, but obviously we would be looking to get the hand just onto the bed. If I come, and bearing in mind this, you okay there? Bearing in mind the surgery as well, I'll be careful here.
A lot of pain that I get in any back.
Okay. How's the sensation on this side when I'm touching it?
I get a dull I can feel.
You can feel it, but it's
Yeah.
duller than this side.
Yeah.
Is there any pain or burning or tingling or pins and needles?
No.
Again, we can see we've got a restriction in extension at the wrist here. We just get beyond neutral. I don't want to overcome this because we've obviously got some surgical involvement there. We also lack a bit of supination.
Totally.
But again, that's the sort of position.
To your side. Okay. I've exposed the patient from the xiphoid process to the symphysis pubis. I am inspecting the contour of the abdomen, looking for any scars, striae, distension, masses, pulsations, and the condition of the umbilicus. I will now auscultate for bowel sounds in all four. I will now percuss the spleen for splenic enlargement at the lowest intercostal space at the left anterior axillary line. Please take a deep breath in and out. Okay. I will now ask the patient if they have pain, so please point to the pain with one finger and I would palpate that area last. I'm going to start with light palpation, noting any distress or superficial masses. I will now use deep palpation with both hands, noting any distress or deep masses. I will now palpate the liver for enlargement, masses, or tenderness. Take a deep breath and hold it. Let go. Take a deep breath and hold it. I will now palpate for the spleen for enlargement in the left upper quadrant. Take a deep breath and hold it. And release. One more time. Take a deep breath and hold it. Okay.
Do you feel it?
Yeah.
Do you feel it?
No.
Okay, so C4. Do you feel it?
Yeah.
Okay. C5. Do you feel it?
No.
And now?
Yeah.
Okay. And now?
No.
And now?
Yeah.
That's C6. And then C6 again.
Yeah.
Okay. C7.
Nope.
C7.
Yeah.
Okay. C8.
Yeah.
And then this is going to be C8.
Mhm.
Okay. T1.
No.
T1.
Yeah.
And then T2.
No.
And T2.
Yeah.
Okay. Thank you.
In testing light touch or any other type of sensation, we're going to always do the unaffected hand first. It's important that you first demonstrate on yourself, then demonstrate on the unaffected hand, and then do the affected hand. In this way, you can make sure the patient totally and truly understands what you're trying to do. So I would say to my patient, this is what I'm going to do. I'm going to touch you very lightly with the cotton ball like this. And every time I touch you, I want you to say now. Okay? So I'm going to touch you like this. And every time I touch you, you say
Now. 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 Now.
So that's what I'm going to be doing.
All right.
Okay? So now we'll do this hand. Okay? So every time I touch you.
Now. Now. Now.
Okay. But now here's the kicker. We're going to do this with your eyes closed. So you can put this hand down for now. Okay, so every time I touch you, I want you to say now. Okay, you have your eyes closed?
Yes.
Okay.
Now. 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 Now.
Okay, you have to be sure to do both the dorsum of the hand, all the fingers, and the dorsum of the hand, as well as the palmar surface.
Now. 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 Now.
So as you noticed, I didn't do a regular rhythm. You need to vary the amount of time between your different stimuli so the person doesn't just get into this now, 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 now. I also moved from finger to finger, finger to palm. I didn't go in any sort of order, but you need to keep track for yourself. Make sure you do every phalanx and the whole palmar surface. Okay, and depending on what your patient's diagnosis is, you may also be going all the way up the arm. Okay.
So next we're going to go ahead and go on to the skin assessment. Can you go ahead and show me your arms? Fantastic. So look at the skin. Your skin color is appropriate to ethnicity with pink under. Temperature is warm to touch bilaterally. I'm going to pinch. Skin turgor, there's quick elastic recoil, no evidence of tinting, so good skin turgor. I'm going to take a look at the nails. Her nails are clean, they're round, smooth, with pink undertones. The profile angle of the nails is roughly 160 degrees, so no evidence of clubbing. And there's no nail polish, so I'm able to easily see capillary refill. Capillary refill is 2 seconds, so it is nice and brisk. I'm going to look, I don't see any infestations, I don't see any lesions. Is it okay if I palpate your skull? Yes. So I'm palpating. Any tenderness? No. I don't feel any masses, I don't feel any bumps. And then I'm going back to your lymph nodes. Is it okay if I touch your face? Yes. So we have preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical chain, deep cervical chain, posterior cervical chain. Can you roll your shoulders forward? Good. It's supraclavicular. Any pain felt? No skin breakdown. I'm going to palpate. Any tenderness? Any tenderness, my press your tragus. Fantastic. Now I'm going to check the other side. So looking at the external ear, there's no redness, swelling lesions, or exudate. Looking down the external auditory meatus, I don't see any cerumen impaction, no redness, swelling lesions, or exudate. Looking behind the ear, there's no skin breakdown. I'm going to palpate. Any pain? Any pain? Fantastic. So move. Go ahead and open your mouth. Oh, very good. So the buccal mucosa is pink, moist, and intact. The teeth are china white, and they are straight and aligned. Finally, I'm going to palpate your radial pulse bilaterally. 2+ with a regular rate and rhythm bilaterally.
Okay, can I see your arm band, please? Oh, okay, thank you. I'm going to go wash my hands and I'll be back. Okay, washing my hands, coming back, providing for privacy. All right, Richard, can you tell me where you are today?
Monroe Regional Hospital.
Monroe, great. Can you tell me today's date?
8/21/2018.
Okay, it's going to feel around on your head. If you have any lesions or discomfort, let me know if you have any pain or any unusual feelings. Any pain, discomfort?
No.
Okay, good. Can you... Cranial nerve 7 is intact. If you can close your eyes for me and tell me where on your face I'm touching.
Forehead. Chin. Right cheek. Left cheek.
Okay, you could open. And now I'm going to make a noise. Just let me know where you hear it.
Right ear.
Okay.
Left ear.
Okay, you can open your eyes. Cranial nerve 8 is intact. There's no lesions, no discharge, no excess cerumen. Everything looks good. No redness, no swelling. Okay. Now what I want you to go ahead and do is raise up your shoulders. Very good. You can relax, you can stop. Now if you push your face against my hand, okay, the other side. Cranial nerve 11 is intact. Go ahead and squeeze my hands for me. Okay, raise them up above your head. Put them down. Shake them from side to side. Okay, now go like this. Don't let me push. Okay, now push against me. Very good. Now move your neck up and down and side to side for me. Side to side with your neck. Very good. Now your feet. Right here. Okay, push against my hands. Okay, now don't let me pull. Okay, good. Your range of motion, I'm sorry. Okay, good. All right, now I'm going to do your lymph nodes. You can just relax normally, okay? So submental, submandibular, we have tonsillar, preauricular, postauricular, occipital, anterior cervical, posterior cervical. Shrug your shoulders. And supraclavicular. Chest, I'm going to go ahead and feel your legs as well. Any pain, tenderness?
Negative.
Okay, good. I'm going to go ahead and feel your pulses behind the knee. So your popliteal pulse. Okay, both are bilaterally present. Then your posterior tibial pulse. Okay, and then your dorsalis pedis pulse. Alright, I'm just checking your capillary refill. Less than 2 seconds. Capillary refill again is less than 2 seconds. A finger please if you don't mind. Okay, capillary refill is less than 2 seconds. Now once again from the other hand. Okay, capillary refill is less than 2 seconds. Very good. I'm just going to do the plantar reflex, okay? Up and over. Okay, up and over. Now put all your weight on my hand, all of it. Okay? This is not going to hurt him. Okay. Your triceps. Okay, now go ahead and put it like this. I'm going to let you rest your hand. Hold on a second, please. Okay, there you go. Okay. Biceps. Please stop. Okay. Keep your hand like that. Biceps brachialis. Please go ahead and do the other arm. Alright, actually, lift your arm up like this. Thank you. Okay, all your weight on my hand. Okay, triceps. There you go. Biceps and brachioradialis. Okay, now you can scoot up a little bit so your knees are, your feet need to dangle, but maybe over on the side if you want, so we can see both legs. Okay, that's fine. Yes. All right. All right. The patella, and then the Achilles tendon. And the same over here. Patella and Achilles tendon.
Your head. Okay, I'm just going to look for any lice, bumps. Feel any pain anywhere? No. Okay, good. Everything looks good. Okay, so now I'm just going to go down to your face. I'm going to assess your face, facial bones. Okay, everything feels good. Okay, I'm just going to go down your nose. Okay, I'm going to inspect your nose while I'm here. Okay, it looks good. Now I'm just going to touch your lacrimal glands. All right. Okay, different fingers, and you let me know when you feel just one tap. Just one. Okay, okay. Okay. Okay, so now I'm going to take your palm of your hand and I'm going to draw a number and you tell me what number it is. 2. Okay, and let's try this one. 3.
Can have your client rest their hand onto some putty. That takes away the extraneous movement when you're actually applying the monofilament. Okay, this putty's a little awkward. All right. It helps if you're in a quiet place. However, hand clinics and rehab gyms are often not quiet. Particularly for this test, I would recommend that you do try to remove as much distraction as possible. The country is highly calloused hands. A lot of our workers, folks that have a lot of callus buildup, okay? And so they will have trouble particularly feeling that normal, the 2.83. In that case, I think clinic filament is, and you slowly touch the skin, get the bend and come off. And it's either it's a yes/no answer, whether they feel a touch or not, okay? So there may, and I tell the client, I may not touch you. Don't mind yes or no if I'm touching you. Yes. Okay. Yes or no? Yes. And yes or no.
No.
Okay. So for her, that's normal in her ulnar pattern. Okay, and you would repeat this in those sites for the different hard as you can. You're gonna push pretty hard before you get a bend. So on this one, I watch for blanching. Okay. So it's really a matter of moving up and down in your monofilaments. And I will tend to complete one section before I move on.
Take a look at any pressure areas. You also need to have a quick look between the toes. And to look for any evidence. So to feel for the dorsalis pedis and the anterior tibial on both feet.
And all I'm going to do is move your wrist up and down. And I want you to give me descriptive words of what you feel is going on during the motion. And you can either say up or down. Okay? And I'll do the same with your fingers, and then we'll switch to the other wrist. So go ahead and close your eyes for me, please.
Okay.
Okay. And tell me what you feel your wrist doing.
Going up.
Okay. And how about now?
Going down.
And one more time. How about
Up.
now? And
Down.
okay, good. So next we'll do the fingers. I'll do the pointer finger and the pinky, so they have two different nerve sensations. So I want you to tell me what you feel your finger doing.
Going up.
How about now?
Going down.
And one more time.
Going up.
And how about now?
Going down.
Good. And we'll do the same with the pinky. What do you feel your pinky doing?
Going up.
How about now?
Going down.
How about now?
Going up.
And how about now?
Going down.
Okay, perfect. So we'll tell. I want you to tell me what your wrist is doing.
Going up.
Okay.
Going down.
Okay. How about now?
Going up.
And how about now?
Going down.
Perfect. Same thing with your fingers, okay? What do you feel here?
Going up.
And here.
Down.
And here.
Going up.
And here.
Going down.
Okay. And the same thing with this pinky. We'll test the same one. What do you feel here?
Going up.
And here.
Down.
Here.
Up.
And you'll have them close their eyes. And I'm going to write letters in your hand with my fingertip and see if you can identify it.
Okay.
Okay, here we go.
B. Oh, I didn't pay attention. Do that one again.
Okay.
M. G. Just 7.
Okay, here we go again.
Oh, a T. Sorry. A.
Okay, so that was the uninvolved side, and so then if they were able to do that successfully, and that just gives them an idea of what the testing is, you would switch to the involved side to test.
Of course, educate your patient what she would feel. We're going to demonstrate on the uninvolved extremity. For the sharp end, I'm going to maintain enough, the pressure light enough that my fingers can slide down there, but you do not want your fingers to make contact with the patient's skin because that is applying an abnormal tactile sensation and could mar the findings of the test. So what we're going to do is just slide down about to there. So what you'll be feeling, Ms. Smith, we're going to be applying a dull pressure. You identify when I put pressure as either dull or sharp.
Okay.
We okay?
Okay.
The dull end, you do not want to create a cavern in your patient's flesh, just enough pressure to dent the skin. Right? How about here? Is that sharp or dull?
Dull.
And here?
Dull.
Here?
Sharp.
How about now? And again.
I didn't get that one.
And now.
Dull. Sharp. Sharp.
And here.
Sharp.
Here.
Dull. Sharp. 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 Dull.
Thank you.
Okay, so close your eyes. Alright, and then tell me if it feels dull or sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. Okay, I'm gonna do your one. Okay. Keep your eyes closed. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Keep your eyes closed. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Okay. They're down. Okay. Up. Down. Up. Up. Down. Up. Up. Down. Up. Same. 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 Same.
I'm going to touch you with the sharp side or the dull side. Okay, this is dull and this is sharp. Okay.
Okay.
So you tell me what you feel.
Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Dull. 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 Dull.
Okay. And we're gonna finish with the temperature test. So this one is hot, this one is cold. I'm gonna touch you and you say if it's hot or cold. Okay, so this is hot and this is cold.
Okay.
Alright? So let's go.
Hot. Hot. Cold. Cold. Hot. Cold. Cold. Hot. 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 Cold. 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 Hot. 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 Cold. Cold. Hot. Hot.
You're only moving your finger in that direction. For example, this is up, this is down.
Okay.
Close your eyes.
Up, up, down, up, down, 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 up, up, down.
Good. Okay. At the wrist, we'll do the same thing. This is up, and this is down. Okay. Close your eyes.
Up, up, down, up, up, down, 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 up, down.
Good. Now at the elbow, similarly, this is up, and this is down.
Okay.
Try to keep your arm completely relaxed while I have the weight of it. Great. Ready?
Up, down, down, up, up, down, up, down, down, up.
Good. And lastly, at the shoulder, this is up, this is down.
Okay.
Relax your arm. Here we go.
Up, down, 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 up, down, up, up, down, down, up, up, down, up, down, 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 up, up, down.
Good. We'll do the same thing at the ankle. This will be up, and this will be down. Keep your foot completely relaxed and your eyes closed. Ready?
Up, down, down, up, down, up, 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 down, up.
Good. At the knee this time, this will be up, this is down. Ready? Close your eyes.
Up, down, up, 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 down.
Halfway refills are less than a second. No lesions or ulcers. Palpate your temporal arteries. Just let me know if this causes you any tenderness or pain. Yeah. Very good. Palpate your lymph nodes. Cause you any pain? Okay. Lymph nodes are in normal range. They're not. The finger and let me know which finger it is, okay?
Sorry.
Thank you. Alright, other hand.
Alright, just go ahead and relax. So, relax into my hand. There you go. So now, if I move your leg this way, we're going to call that up, okay?
Okay.
And if I move it back this way, down.
Okay.
Okay? So, from here, I'll have you close your eyes, and now I want you to tell me where I'm moving it.
Okay.
Okay? Here we go.
Down, down, up, 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 down, 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 up, down, up, up, down.
Here we go.
On my right thigh, my inner knee, right here, inside of my right ankle, inside of my right knee, the top of my right foot,